everybody. How you doing? I'm Jeff Vanderbeck, publisher of the News Express in Pikeville, Kentucky here. I'm sitting here with Tammy Riley from the Pike County Health Department and Laura Fraley from the Pike County Health Department. Laura's the Public Health Program Manager. We're going to start a series of educational podcasts to talk about what the health department does for the residents of Pike County, how they help people, and how their mission is to make Pike County a more healthy place to live, play, work, and all kind of things. There's many programs that the Pike County does that has that. And if you go to their website at pikecountyhealth.com, you'll see a lot of things on their website that talks about the fantastic things that they're doing and how they're outreaching to a lot of things. And we've got a couple of things we want to talk about, but specifically today, I'm going to let Tammy and Laura talk about their harm reduction program. But guys, first of all, welcome to the podcast. This is your podcast, and I want you to make sure that you really are comfortable talking to the folks out there and seeing what we got going on. I went to your website like I always do. Check it out, and you've got a lot of things going on. You've got your clinics that you have that talk about family planning, immunizations, the WIC program, very beneficial, very educational. Talk about educational opportunities. If you go to your website, you've got emergency preparedness, which is, I mean, Lord knows we've had some really bad emergencies lately, right? Absolutely. And that helped us out. There's diabetes prevention. There's all kind of community research. There's even a section on there where folks are food deficient. There are food giveaways. I think there's 15 different outlets where you have on your website for people who are needing food that can go out and there's food giveaways on a weekly basis. Very beneficial. We talk about environmental things, food safety, restaurant inspections. You know that you send those restaurant inspections to us. We publish them in the newspaper. And if we're late by doing that, we get calls from the community because they want to know what's going on. So thank you for doing that, because that's a big help. And then there's the HANTS program, which is a great program for new parents who are just, stressed, concerned. How can I do this? What am I going to do? I've got this baby coming out. I've got this child to come out. How do I manage this? How do I do that? And if you look through that, the resources are there to walk everybody through and you just talk them off the ledge, so to speak, and get everybody happy. And then there's the Bright Smiles program. We're going to get into all these educational opportunities at a later date. The Bright Smiles is a really cool thing. It's a preventative dental hygiene program from K through 12. Go back and, I really encourage you to go on the website and see all the educational opportunities and all the great things that the health department's doing. But one of the things we really want to focus on today is what we call, or what you guys call, the harm reduction program. Right. And I want to know a little bit about it, how it works. I know we've got narcan. We're going to get into that here in a few minutes and the importance of that and all that stuff. So Tammy, tell us a little bit about the harm reduction program, what it is, how it works, who can be involved, and all that.
Thank you, Jeff, and thank you for hosting us today. We really appreciate it. I think before we get into the nuts and bolts of the actual, the components of the harm reduction program, that people will want to know, why? Why do we have a harm reduction program and why is it important? And just very briefly, a little history behind harm reduction programs in the nation and in Kentucky specifically. There's a very well-known study, a CDC study from 2015, that looked at vulnerable jurisdictions across the country after some high-profile HIV, Hep C cluster outbreaks. And what they discovered is those outbreaks occurred around injected drug users' activities. So they were related to clusters of IDUs. We call them IDUs. So around these communities were involved with this outbreak. So when they conducted the study, they identified the top 220 counties in the nation that were at high risk or vulnerable communities to an Hep C, hepatitis C, or HIV cluster outbreak.
And that also includes transmittable of STDs, correct?
Yes. It was just a communicable infectious disease.
And where was Pike County located?
Pike County was 21st out of the 220 counties.
Now that's not, we're in the
nearly
25.
Top 10%.
Top 10%.
Nearly.
Not good.
Right, not good. Okay. And what we found is that 54 of those 220 rural communities, 220 were in Kentucky, most of those in eastern Kentucky, with Pike County, again, being nearly in the top 10% of the 220. So, based on that study and in information that was gathered from that study and the cluster outbreaks, that's where we get many of our best practices and protocols for harm reduction programs. The harm reduction program in Pike County, and every county in Kentucky has a harm reduction program, and provides some, if not all, of the services. That Pike County has had a harm reduction program since 2018. We we offer those services from the local health department in downtown Pikeville and our Belfry Health Department, and then also via mobile unit outreach. So we try to take the harm reduction services to where people are. That may be under a bridge, it may be in a homeless shelter, or it may be at the local health department.
When we talk about harm reduction, I know it talks about needle exchange. What other aspects are tentacles or in the harm reduction program? Let's talk about the protection part and the core protection that you guys have.
Right. Yeah, we'll talk a lot about protection when we talk about the health department. Our focus is on prevention, protection, promotion, and the harm reduction program prevents and protects the community. And I'll in a minute let Laura get into the components of the harm reduction program, but I'd like for the community to think of the harm reduction program like an umbrella. And the spokes on that umbrella are components of harm reduction. And the umbrella or the harm reduction program protects the community. So it not only protects and improves outcomes from those suffering from substance use disorder, but it protects the entire community. But within the or under the umbrella, the services of harm reduction, we offer narcan, education, referral to treatment, syringe service program, referrals, linkage to care, and services like SNAP and housing. And we do that from the local health department perspective, and then also via the mobile unit outreach.
That you brought up some very good points about that, and jump in when you say something. So a lot of I think the misconception is that by having this harm reduction program, we're enabling people, and I think the misconception needs to be the complete opposite, or the perception needs to be the complete opposite. If somebody is in need, you don't just give them a free needle and say, "Oh, go shoot up in the corner." You're trying to counsel them, get that person at the treatment. And it's also preventative from spreading HIV, AIDS, or any of the other diseases associated with IV use, particularly with dirty needles. So I think the most important takeaway from the harm reduction program is it's not an enabling program. What it is, it's a prevention program.
It's just the opposite of that.
Right.
We know that individuals who engage or participate in syringe service programs are much higher, 85, 86% more likely to enter treatment. And when they receive those services, they're getting referral to treatment, they're getting education. But, if you're one of those individuals, those lucky individuals who live here in Eastern Kentucky and you have not directly been impacted or indirectly, closely, like with a loved one, neighbor, family member, by substance use disorder, you're lucky, number one. But if you're one of those individuals that, you would see this program as enabling, or it just doesn't matter to you one way or the other, you likely do care about your family, your close loved ones. And this program is not only assist those who do suffer from substance use disorder and improve the health outcomes for those individuals, but it protects the entire community, which is hence the name harm reduction. It reduces potential harm to the entire community, because we know from history and from studying, this disease state that communities with high levels of this type of activity are at a higher risk for hepatitis C, HIV, and other infectious disease, outbreaks.
One of the things that I think is another point where I think we need to hammer home is if I'm a grandparent, a parent, an uncle, and I'm not an aunt, but if I were an aunt and I did have some folks and family members, or as an employer, if I recognize somebody who may have a problem, I mean, this is considered a disease right now, and the federal government has said, drug addiction is now a disease under the ADA compliance rule. But if I do that, instead of calling the police on this person, what do we do with this person? If I see a family member or employee or a person that it just is on drugs, and there's no way, we've tried avenues, what's our step? How can the Pike County Health Department help and reach out, and what should a concerned citizen person do?
And that's really where Laura comes in. She's boots on the ground managing harm reduction program. She and her team are under the bridges and cleaning out. They actually have the correct, tools to do this safely, but they gather these dirty needles and they collect them. They know where the activity is, and they go to those locations to ensure that clean needles are given out and that they do an exchange. So the individual's required to return dirty needles in order to get the clean needle and to get other types of services and resources that we offer.
Sure.
So it's just all the way around, reduces harm to the program. But Laura can speak to your question about, being an employer or a family member of someone who's suffering from substance use disorder.
And also, I want you to, another great point, Tammy, you just hit on. She mentioned, you guys go and pick up dirty needles. How vitally important is that if you're out at the park, or you're out at the playground, or you're with your children, talk about what steps people should take if they do see a syringe or a hypodermic needle on the ground. So talk to us about that, if you don't mind.
Yes, of course. And so a lot of people don't realize the other services that we talk about. Some of them speak for themselves, like the narcan distribution. We see a decline in overdoses, and we know there's studies for our rapid HIV and Hep C testing. But a really important component to what we do is that resource navigation. So if anyone, I'm sure there's been a lot of people affected, has tried to navigate that, whether it's for themselves or for a loved one, it is not, it's a heavy feat to do. So for us, for the first question, when people come to us, whether it is a family member or they need help themselves, and we have a really nice resource list, we like to really provide that individual care. So a lot of the times, if instead of giving them that resource list, we really get to know them on a deeper level, and we listen. Active listening is huge in this program. We build relationships with them. So when they come, we know that, say if I have someone that comes and they need treatment and they're still in active use, and through that relationship with them, they've told me, I have severe childhood trauma. And so, or I've had sexual trauma. So I'm not going to send them to that co-ed center. I'm going to give them that individualized care. So their outcomes are increased automatically. So I look at that list, and we know there's 50 treatment centers around, but really paying attention and listening to them and giving them the care that they need. And it's the same for family members. And it kind of can go hand in hand with mental health. When you think about mental health, and if they're in a crisis, they need a provider. If they're in grief, they need a grief specialist. And I really think that a lot of the times we're missing that individual element for the recovery process afterwards. And we do that until they're with that stage 2. So we provide that education. And the community cleanups is really special to us. We do multiple community cleanups throughout the year, and we go to the parks and stuff. But I have had calls where people have called and said, we want to take the burden off of the community.
We wouldn't want individuals,
the family. We can and get it. Exactly.
Encouraged.
And we want to take the burden of navigating this really, tumultuous resource list and how to navigate, because we don't want them to lose hope. And that's what we see a lot of the times is in that navigation, they'll get defeated with the closed doors, or we don't specialize in this, or we can't do this, or you don't have insurance. We want to help them with that navigation, and we want to help the community. If you see a hypodermic needle in the park, call us. We'll come and get it.
Yeah, absolutely.
Mm-hmm.
They would want to call us. And Laura was referring to an approach to substance use disorder management that we call conflict-free case management. So the health department, for example, we have a conflict-free approach. We're not into the treatment business, but we can, and it is something we can talk about later, Jeff, but we're actively working on launching what we call Recovery Resource Center. We're already doing almost all aspects of it to some degree, but it's where we help individuals navigate this very complex ecosystem of substance use disorder treatment for the individual or maybe for a family.
Okay, so
We can talk more about that later, but
I think another takeaway is that if a family member is afflicted with this disease, they're probably not of the right mind to be able to navigate or comprehend the navigation tools that you guys are giving them, whereas the family is going to be helpful. So if a family member does recognize something, it's important to not only get the individual who's been afflicted with this, but also the family members to come on there. Let's talk about Narcan. Tell me what Narcan is. And I understand you're the you have a you need to have a cape. I understand that you're the queen of Narcan distribution. Tell me what it is, who should have it, and why we should have it.
yeah, Laura really is, she saves lives in the harm reduction program, is saving lives every day with Narcan. It's 2 doses of 4 milligram naloxone. It basically, an opioid receptor blocker. It's very safe, easy to use. There's 2 actual doses in here, and Laura works with individuals, anyone who wants Narcan. I've said many times publicly and just privately to individuals, every single individual in Pike County should have Narcan on themselves. We have heard story after story of people being saved by Narcan in parking lots, hairdresser, all clinics, retail stores. I mean, it happens on the daily. First responders, of course, are dealing with it daily as well. And Laura works with first responders, and many of them either get their Narcan supply through the FR Care program, or sometimes they'll work in coordination with us. But Narcan saves lives. Jeff, do you know the one criteria? There's one and only one criteria to enter treatment for substance use disorder.
No.
It's to be alive. That's the only criteria.
That's a stupid question.
Yeah. Well, it's the only criteria, and Narcan saves lives.
Right.
We need to save people's lives to increase the outcome of their ability to survive. And it's just a really important aspect. And it's working. We just heard the governor announce that Kentucky for 2 years in a row has lowered the overdose fatality rates.
One of the things that I hear a lot is I'm not going to administer Narcan, or two reasons why. Heck with those people, let them die. They're on drugs. We don't need them in here anyway, and they're a scourge to society. We don't need them. That's the first thing. The second thing is, if I roll up on somebody and I've got Narcan in my car, what's my legal liability if I administer to this person who either A, doesn't need it, or needs it and decides to sue me? Is there a good Samaritan savior that saves me as a consumer, as an individual that will, trying to help somebody who I think is dying? I'm not a doctor, as you clearly know. I'm not smart enough. Heck, I'm not even smart enough to write down stuff. You know that. But if I roll up on someplace and I see somebody doing something, and I administer, can I get sued?
Oh, that's a really good question.
No, you cannot. You are actually protected under the Good Samaritan law to respond. And I know we had a lot of fears that maybe they're not overdosing and they're having another medical emergency. And the good thing about Narcan is it's only going to respond to opiates. So even that second thought or anything like that, you would be protected under that.
It blocks opioid receptors.
Yes.
Suddenly. So if you're not overdosing, it's going to block those receptors.
Yeah.
I always use the analogy: if you find someone who has hung themselves, would you be afraid to cut the rope to allow them to fall down because you might break their ankle?
Tammy, that's pretty damn morbid. I don't know, but I mean,
most people would likely attempt to save the individual. I mean, Narcan is safe. It's easy to use. It saves lives. We've seen it in the nation, in the state of Kentucky, that we're seeing a reduction in overdose. And you mentioned cost, and the cost of not utilizing Narcan, it's too high a price to pay.
One of the reasons why, I was telling you before we started this podcast, I got pulled over, and as I opened up my glove box, the officer who pulled me over said, "What's about the Narcan?" I said, "He goes, is that for you?" I'm like, "No, it's not for me. It's for you." if I roll up on a scene, I think one of the things that some of the folks that I hang with, I'll carry it if I find a first responder who has been, inadvertently in touch with because right now you got fentanyl. If you touch it and you do, go on your face, you could be really adversely, as a first responder, affected by it. So I carry Narcan on my person at all times, just in case first responders or anything like that need it. And I think that's another reason why we do that. You're in an airplane and the things come down. They say, put it on yourself first before you can help somebody else.
Absolutely.
Well, I roll up on a scene there. I help the first responders before anything. Tell me about this takeaway bag right here. Tell me what this is about and who gets it.
The Leave Behind program. It's a wonderful program. Laura, you want to describe the Leave Behind program?
Yes, so the Leave Behind program is what we give to first responders. So whenever they respond to an overdose, a lot of the times when they respond, they may refuse medical treatment afterwards, and their reoccurrence is pretty high. That they'll have to respond back to the scene again, and we've heard that for several first responders. So what we do is we give them the Narcan so they can leave behind anytime they respond to an overdose, because sometimes they may be farther away and it may take them longer to get there. So it's going to help the person receiving it. It's also going to help the community and the first responder in their time and managing their time. What's really important about these bags is that when they refuse that medical care or going to the hospital, there's resources in there. So they're not just left with nothing. They can get in there. They can find resources. They can call us. It lets them know that there's some hotlines in there. But one of the most important things is these are local resources. They're not, you have to call counties away and wait on that. They're local. So I think it's really invaluable, and it's going to help not just the first responders, but especially the person, because at the end of the day, it's somebody.
Sure. That's right. And Narcan is, although vitally important to the harm reduction program, is only one component.
Yes.
And I wanted to recap, and I know you'll want to wrap up for us, Jeff. But just to recap the harm reduction program, we help families, individuals navigate the resources that are available in this county, but it can be complicated and confusing. We provide education, referral to treatment, access through the mobile unit, the syringe service program. We also offer rapid HIV, hepatitis C testing at no cost to the individual, and routine community cleanups that Laura talked about, Narcan distribution, and the Leave Behind program. So there's many components to the harm reduction program.
And one of the things I want to leave you guys with, first of all, congratulations. From 2023 to 2024, there's been a 30% reduction in overdose cases thanks to your efforts. So thank you all for tuning in. Thank you, Tammy. Thank you, Laura. We'll be back in a couple more days with more information about how the Pike County Health Department works to make Pike County a healthier place. Thank you for your time. Have a great day. And please, if you know somebody that needs help, it's 509-5500 or pikecountyhealth.com. Use it. It's a great resource. It's free to the community. And have a great day. Ladies, thanks for joining me.
Thank you. Thank you.